What's his name? Oh, we have to get off. You can talk until class starts, but it's 6 now, so we'll go ahead and get started. Okay, to give y'all the agenda for today. We have a fairly brief lecture about ethics. And then y'all will do a group assignment. And then, I actually have the template for the IRB that we'll go over. So this is what you'll end up filling out with your groups. It's very much part of ethics. So we'll spend some time going over that after the group assignment. I am going to take attendance out loud just the next couple weeks till I get to know everybody. And then hopefully I'll be able to just check you in as you come in or as I come in, depending. Alrighty, I do not think Terry is here, Terry Chambers. Okay. Caitlin, I saw. And Elijah. Ariana. Caleb Forster. All right, Daviana. Emily. And Vincent. Julia. Both Julias. Actually, your names are even right next to each other on my list, just to be even more confusing. All right, Allison. Hi. Trinity. Hey. Abigail? Which one do you prefer? Okay. Nathan. And is it Jocelyn or Jacelyn?
Jocelyn.
Jocelyn. Okay, I'm gonna write that out phonetically for myself so I don't F it up again. Alrighty. Cool. So just wanted to kind of like remind you of the schedule because this is a once a week class. It's gonna feel alternately like we're going really fast, and then other times like we have all the time in the world in between class. So just a reminder that for next week, the 7th, it's my mother's birthday. I'm just realizing I do have a present already. Don't always. But we're gonna have you all turn in your group project topics. So maybe on the break or after class today, be chatting with other people that you know about, you know, what kind of questionnaire you want to come up with, what do you want to measure? Some things people have measured in the past, like different types of depression, mindfulness, hopefulness. One year someone did like body image, but specific to athletes. So there's really like a whole host of, I mean, the world is open to you, basically. And so you'll just turn that in on a piece of paper to me. If you know already who you want to work with, you can turn in one paper for all the group members. Or if you don't know yet, you can turn in an individual one and I'll group you with other people who are interested in similar topics. And then next week, I've also passed out exam 1, and then that will be due in class the following week. So again, feels like we're going really slow. And then like 3 things are going to happen at once because that's just the nature of a once a week class. But I just wanted to kind of keep that in your mind since that will come up pretty quickly. All righty. Go ahead and get to our PowerPoint here. Alrighty, so we're going to be talking primarily about ethical issues, but we'll also be talking about legal and professional issues as well. If this chapter in particular excites you, good news! Our capstone class in psychology is now this, basically, it's ethics and professional issues. If it doesn't excite you, that's okay. We get much more into the professional issues like job hunting type of things in that class, and that seems to strike a chord for folks in general. But this is uber important because we need to make sure we're doing things in a way that's ethical, not only just to be ethical or goody two shoes, but also because we want to make sure we do right by the people we're assessing, right? We don't want to screw them over because we just didn't care, right? Or weren't qualified to give that assessment or didn't like them as a person. So it's really important. And as you can tell from the title here, there are also legal ramifications in some cases. So if you are a licensed mental health practitioner and you screw up on anything really, but on an assessment is one of the places where it might be more obvious, you could get sued and or lose your license, right? So you don't want that to happen. It's not a good idea. So we teach about ethics very early. Alrighty, so in the back of your book, there are the relevant sections to assessment for both the American Counseling Association. So this is an Appendix B, page 308 of the hard copy. I'm not sure if it matches up exactly for the online copy. And so that gives you the American Counseling Association's ethics code, and then you'll see that on page 311, the American Psychological Association is going to be really similar. What's the difference between a counselor and a psychologist? Very good question. There's a lot of overlap in what we can do, but there are some primary differences. One is that schools of counseling psychology are often housed in departments or schools of education. So typically counseling programs might get an EdD, like people in the ed department have here. I think some of the people in the sports and recreation majors have EdDs as well. But there are some PhD programs in counseling as well. Counseling tends to focus more on sort of everyday problems of living, what you would expect if you were serving as a school counselor at any level, right? Whether that's, kindergartners up through college, right? The type of problems that would come through your door. So they're often working in those settings or in private practice. So people who wanted to get to be a counselor, a couple different routes you could take. Typically you go through exactly what y'all are doing right now, 4 years of undergrad, and then you do grad school. If you just want to practice, some places will let you do that with a master's. You could just get a master's and then get like a LPC, licensed professional counselor licensing. If you wanted to study counseling, maybe work at a higher level, teach about counseling, then you'd go on and get that EdD. Psychologists, and in particular clinical psychologists, are going to go through a similar process, but there are again sort of 2 degrees. You most often see a PhD in clinical psychology, and that is a very traditional PhD where in addition to learning skills on how to work with clients, you also do research. But you can also get a PsyD, PSYD, and that's like all applied, essentially. Even your dissertation would be like more of an applied project. To get a degree in psychology at the higher ed level, again, you can get a master's in clinical if you just want to practice, or you can get the PhD. That's what I have. And that allows me to practice if I were to get licensed, teach, do research. I could be a consultant, I could be a lobbyist. There's a whole bunch of things I could do. And I think there was something else in the tip of my tongue I wanted to say. I am very well trained in research, which people in PsyDs don't normally get. But I think the makeup of my internship or residency class kind of shows you how much these things might be kind of semantics. So there were 3 of us who were from clinical PhD programs. One was from a counseling PhD program, and one was from a PsyD. So like we were all getting the exact same pre-doctoral residency training, right? So these things do intermix. Oh, that's what I was going to say. If you are a clinical psychologist, it's much easier to get jobs in places like the VA, hospital settings, things along those lines. They often want you to have a doctoral degree to work in those places. And especially like teaching hospitals, they often want you to have the PhD for that. It's a little bit of a sidebar, but because the person who wrote this book is in the counseling program, I think it's important to take at least a minute to talk about what are the similarities and differences between sort of clinical and counseling work. Both are very well trained in how to do assessments. And in fact, our counseling person in our residency program, he worked with kiddos, which like I really respect anyone who does clinical work with kiddos. The people in my program who did child clinical had to go through like an extra year of coursework because you have to learn all the developmental stages, right? And I'm just remembering a story where Brandon, what's his name, Dr. Register, was trying to do an assessment on a kid, and the kid took his chair and like wedged it in front of the door and was like, I'm not gonna do this if you can't make me. Brandon is 6'2" and pretty beefy, so he just picked the chair up with the kid in it, ripped him, and went and got his supervisor. And I was like, man, I don't know what I would have done if I was in that situation. But this shows you a little bit of how even what you would think would be maybe a mundane assessment, everyday assessment, Brandon had done tons of those assessments in his life, can end up being maybe a little challenging, have some issues you might have to navigate. It can get exciting. Give you one more example story. My grad professor who taught me psych in the law and assessment, he would do forensic assessments sometimes. So he'd actually go and screen people for like not guilty by reason of insanity, things along those lines. And he gave this person a standard assessment one time and wrote that person, instead of filling out all the little bubbles, just wrote across the whole thing in big block letters, "I am not crazy." And it's like, well, if you had taken the time to actually fill it out, this would show that, right? But now we don't have much to work with. All right, so just to give us some context and also to recognize that the process of doing assessments is not always cookie cut. So both of these codes are going to emphasize the same things. So we want to make sure we're choosing appropriate instruments. Appropriate assessment instruments are going to answer the question we're asking, but then also age appropriate, right? We don't want to give a test made for children to an elderly person or vice versa. Competence, do the people who are giving those assessments, administering those assessments, have the training and credentials and know what they're doing? Confidentiality, this is true in assessment therapy, any part of clinical or counseling work you do. In the vast majority of cases, it's just between you and the client. And you've got to keep that confidential with the exception of any supervisor you have who's supervising your work and you share with them. Cross-cultural sensitivity, knowing potential biases of some of these tests and whether they're appropriate. What if the person doesn't have English as their first language? Informed consent, knowing that that person understands why we're doing this assessment and what the potential outcomes could be. We want to make sure that we minimize invasion of privacy. All assessment's going to do this a little bit because you're trying to sort of assess inside the person's mind. If we are giving a diagnosis as part of our assessment, we want to make sure that's accurate. We don't want to be misdiagnosing people. Release of test data. And the vast majority of times, you would only release like a report you wrote. You wouldn't give out the raw data, and we'll talk about why that is. Making sure that you're administering the test the way it's written, the way it's supposed to be administered, and not going sort of off book. Test security. So part of the ethics and really legal part of doing assessments is that a lot of these tests have copyrights on them. So if you were to just give it out to somebody, in theory, legally, if you didn't pay for it, or you share it with someone who doesn't have authority, you could get sued, right? You could get in trouble. And then test scoring and interpretation. So not only do you have to know what you're doing when you're giving the test to the person, but also when you get the results, you have to know, what do they actually mean by this? What do the scores mean? And what does that mean? What are the implications of those scores? And so we're going to go over each of these in a lot more detail. And so choosing an important, the appropriate instrument, big thing we're going to look at here, and actually a lot of what we're going to talk about next week in class, is test worthiness, in particular, reliability and validity. So you want to look at, does this test measure what it says it's measuring? And does it do that consistently, regardless of when you give it, who you give it to? You also, part of this is cross-cultural fairness, right? If a test is written and normed just on, I don't know, the sons of billionaires, right? Okay, probably some bias in there. We want to make sure we're giving it to people of different socioeconomic statuses, different levels of education, different ages, genders, ethnicities, races, etc. And also practicality. Is this a test that this person will be able to engage with? Right? So if you want to give an entirely visually based test and your client is blind, it's not going to work, right? You're going to have to come up with another one you can use. All right, so for competence, hopefully this link still works. It's always an adventure. Hey, it does. All right. There are actually these agreed upon levels of competence that the field agrees on, but also the people who sell these assessments. So you can't even buy these assessments unless you have a certain level of competence. So for the A-level products, and like here are some of the examples of those types of products: questionnaires, things that are proctored with videos, things along those lines. People with A-level is basically anyone can administer it, score it, and interpret it, who can read the manual, basically. Like, this is not hard to give. You all could probably give it because you are intelligent people. You could read the manual and you could give it and score it and interpret it. So an example of this would be like educational achievement tests, the like graduation tests you have to take, or things along those lines. All the teachers can administer those, right? Even those that can be technically classified as like psychoeducational tests, anyone can give. The level B products, let's see if it gives us a little more here. Once upon a time, it gave more about the qualifications, but doesn't look like it does here, or maybe here. It's always fun when people redo. Here we go. This is actually the slide I'm looking for. So yeah, level A, no special qualifications. So for level B, you do have to have technical knowledge about not only how to use the test, but about how the test would have been constructed, and advanced coursework in psychology. So at least some graduate courses. But so what they're saying here is if you have a master's degree in any of these things, so psych, education, speech language pathology, occupational therapy, social work, counseling, or a related field, and have training in how to do assessments ethically, you can do it. Or if you have certification or full active membership in certain organizations that require you to have that training in order to join, then that would qualify. A degree or license to practice in healthcare or an allied healthcare field. Formal supervised training, basically. So if you are in training, right, essentially, you could administer it because your supervisor will know and you will have some training on how to give it. Or if you work for an accredited institution, so there is a job you can do, and I'm going to blank on the technical term for it, psychometrist, I think, where basically your job is to give assessments, but you just kind of give them and score them, and then you give them to someone with a PhD to interpret them and write up the report. It saves the person with the PhD time and money. You can make decent money doing that. And so if you are in that case, you could give this because they know as part of the job description, you're being supervised. Okay, so level C is me. Level C is someone with an advanced degree in psychology, like a PhD. And so tests here require a high level of expertise in test interpretation. So you have to have a doctoral degree in psychology, education, or something related, with formal training in the ethical administration, scoring, and interpretation of these assessments, or license or certification, or that active membership in like very specific organizations. So it was really interesting because I know I was going to teach this class when I got to VW well, it's VWC then, but it's VWU now. We used to be a college back in the day. But because I know I was gonna teach this class and other classes where I mention assessments, I wanted to get copies, like physical copies of the tests. And so I actually called the company and I was like, okay, so look, I have a PhD, but I'm not licensed. Can you sell this to me? Because like, to me, that felt a little weird of like, I could just buy it. And then like, in theory, I could rogue give it to people. I'm not going to, right? They're assuming that since I have the PhD, I have the ethics training. But it just felt really weird. And they said, yeah, you're a level C because you have a PhD. So it felt a little weird, but I do in fact have copies of intelligence tests, the Rorschach, the latest version of the MMPI, and so I will share those with you as we get to those types of tests. The other cool thing is that the people who had my position before I got here were sort of historical site collectors. And so, for example, when we talk about intelligence tests, I have in our archives an original version of the intelligence test. It's in like this little brown wooden box, and like the materials are very different. I have the original version of the MMPI, which is like kind of on a clipboard. It's very interesting because now we generally give it on a computer. So, you know, we will learn a lot and be able to look at a lot of these materials because I'm a level C. There you go. And actually, I think I am going to really quickly update my link here, just so that it takes me right to the proper page. There we go. All right, so you have to have that level of confidence not only to buy it, but to give it, right? And then there's confidentiality. So in general, we are going to maintain confidentiality. We are going to say, this is between me and you, my client, and I will give you the results. No one else needs to know. But there are times where not only should we think about breaking confidentiality, but like legally and ethically, we have to. So, for example, if the person's in danger of harming themselves or someone else, we are required by law to not only like report them, but get them help. So like get them to a hospital. If they have specifically threatened someone else's life, we have to warn not only the police, but that person. And that particular confidentiality break comes from a case that's often referred to as the Tarasov case. So if you're not familiar with this case, it was Tarasov versus the Board of Regents of the University of California. A student, like graduate student, clinician, had a client who told the student clinician, I'm gonna go kill my ex-girlfriend. She was like, I don't know what to do. So she talked to her supervisor and they reported it to campus police. And they kind of brushed them off and he went and he killed Tanya Tarasov, his ex-girlfriend. And so at that time, the student and her supervisor believed they had done the right thing and the legal thing. But through the court case, what the judges ruled is that no, they should have also warned Tanya directly. And so because of that case law, now anyone who finds out, whose client says, I'm going to go kill this specific person, has not only like the ability to, but the legal obligation to warn not only the police, but the other person, and probably to try to get that person in front of them, their client, help, right? So that's a big one. Kind of hand in hand with that one is if you hear of any kind of abuse of someone who is in a subordinate position, a child, an elder, someone who has a developmental disability and therefore their mind is sort of in a childlike state. If any of those people, your client says they're abusing them, you are mandated to report them. And usually in your initial informed consent, you let people know about that. You also, if you have a client that's a kid, their parents typically have a right to that information. So even if that person's 17 and really would prefer not to have it disclosed to their parent, if their parent requests it and won't back down when the therapist explains or the assessor explains why that's not a great idea, you still have to give it to them. So that can be frustrating and make that alliance with the person you're assessing a little tenuous. If the client asks you to break confidentiality, this is not an assessment, but to give you an idea, I had a client I saw in my residency who she was really struggling with her depression, and her husband was just not psychologically minded. He just didn't get it. He thought she was being lazy. And so she asked, can I bring him to a session and you can help me explain this? And I said, yep, sure, let's do that. So he came in and the three of us sat down and explained it to him. And it was like a little light bulb went off in his head. And he was like, oh my gosh, I didn't realize it's like a disease. And, you know, it's not everybody has the privilege we have to like get psychological training, right? So there are times where you would do that. You can also be bound by law. So if you're doing an assessment in a legal setting and it's ruled by the court, they say you have to do this, and the court says, sir, you need to get an assessment done, we're going to give it to this psychologist. Your client is no longer that sir that you're assessing. Your client is the court because they're who hired you. So you need to let that person know going in, anything you say to me is going in the report to the court, right? So if you tell me, yeah, I murdered 3 people, that's going in my report, right? So like, how to give them the heads up, just answer the assessment questions. I already mentioned supervision in passing. So when you're in training and you're doing clinical work, you always have at least one clinical supervisor, someone with a PhD, or someone higher up in your program who is going to be guiding you, giving you feedback, helping you craft the assessment report, things along those lines. You can also get a release of information from the client to share it with somebody else. And so, for example, one of the things I did with assessment in grad school is for a year I did pre-surgical psychological evaluations for people who were going to undergo bariatric surgery. So what used to be called stomach stapling, it's now gastric bypass, gastric sleeve, gastric banding. And those folks all signed a release of information for me to send that to their surgeon, because the surgeon needed the report clearing them to get insurance to clear the person undergoing the surgery. So there are cases like that where perhaps they want their primary care doc to get a copy or something along those lines. All right. Cross-cultural sensitivity, right? We need to keep an eye on this as well. You need to know the potential biases of existing assessments when you select, administer, and interpret them, right? Again, looking at, does this show a bias against people of a specific nationality, or if English is their second language, things along those lines. Either choosing an alternate assessment, if that's available, or if you use that one, including caveats in your reports that these should be interpreted with caution. Obtaining informed consent. So when that person comes to see you, the first thing you should put in front of them is a written informed consent explaining what you're going to do and why, who's going to get that information, and other procedures and policies, including things like what the fee will be. Not only should you hand this to them, you should also verbally go over the high points. Because, all right, let's all be honest. What happens when you go to like your doctor and they hand you the patient bill of rights, or what do you do with it? Just sign it, right? Especially like, I'm actually pretty good at like reading stuff because of this, right? But like now that I've signed that like 20 times and I know Centera has the same one, I'm just like, yeah, sure, whatever, right? You didn't change this since the last 20 times I signed it. But yeah, so that's why you want to make sure they actually understand what's in there, right? Because sometimes they might not. In terms of invasion of privacy, as I mentioned, because we're giving a psychological test, you're going to do that at least a little bit, right? This is not something they typically just like tell a Joe Schmo on the street, or maybe even their best friend, right? So you try to minimize that though. You know, only asking the questions you need to ask that are relevant to the assessment. For example, if someone came to you for like a learning disability diagnosis, in most cases, it would be completely inappropriate for asking them for a detailed sexual history, right? But if they came to you because they're having sexual issues, then that would be appropriate, right? If a diagnosis is part of your final reportings and it's not in all cases, you want to make sure that you are accurate. What are the repercussions of diagnosis in general? What happens to people when we tell them you have depression, you have PTSD, you have this label now? Yeah.
They believe that.
Yeah, exactly. They believe it, they can internalize it. Some people will say, well, I can never be fixed because I have this thing, right? And then how can other people react if that's now on their permanent medical file? Yeah. Potentially discriminate against it. Exactly. Or even if they're not meaning to, right? Oh, we should treat this person with extra caution because they have a psychological diagnosis, right? Or think about a kiddo, right? If they're diagnosed with a learning disability, most schools now are good about it, right? But you're still going to have some schools where, oh, you're slow, you gotta go in special ed and blah, 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 right? And again, not that there's anything wrong with special ed, it does great things, but like that's used weaponized against them, right? So you want to be really careful. You want to only release your test data to individuals who have the right to that data and won't misuse it. So your report is going to go to that person and only to that person, unless again, the person who hired you is the court system or that client signs a release of information. And again, who is going to get that should be in the informed consent. And if they want to do a release of information, they got to sign it. It's got to be like legally taken care of. You want to administer the tests in the proper way that they were standardized. Again, give you guys an example that's not mine. The same Professor Jack Graham, who taught me forensic psych and assessment. He told us the story of this case where the MMPI is supposed to be given like pencil and paper or on the computer. But if someone is illiterate or has like severe dyslexia, there are standardized tapes. I'm sure that's like a digital file now. Back in my day, they were audio cassettes that you play and they respond to. And that's so like the voice is the same every time. Well, in this case, I think it was the person's lawyer had read it to them. It's like breaks all standardization. Why should the lawyer even have access to it, right? And so I think it was either Jack or Yossi, maybe both, two of my professors, who were called to testify and say, this basically invalidates the results of the test because it wasn't administered in a standardized way. So yeah, you don't want to do that. And it also could like get your client in trouble. Test security can be really tricky, especially in court cases or when well-meaning people want to see more. So typically what we give to a court or to someone's doctor or to like, if I were to do an assessment and hand it off to Crit for someone for accessibility here, we just give them the report that says, here's what's going on, here are the recommendations, here are the accommodations the person needs. But some places will be like, oh, but I really need to see like the raw scores or the data or the actual sheets from the assessment. There's a couple issues with this. One is that so much interpretation goes on between those raw scores and what goes in your final report that if you're not trained in it, those scores are almost meaningless. The second thing is, like I mentioned before, these are copywritten, and only certain people with certain levels, right, can even have access to them. So you technically could be violating copyright law if you gave that person's raw scores on the like copywritten form to the person. So you have to be really careful. And then test scoring and interpretation, you need to do this in a standardized way as well. More and more, particularly longer assessment instruments now have computerized scoring, which is great because A, it saves you time, right? But also B, that you don't have to worry about interpretation or you messing something up when you're scoring it, right? And also you need to understand the limitations of the test information. So for example, the main intelligence test, sort of the gold standard that we give, the WAIST, back in the day, they used to use your scores on the WAIST to also like talk about your personality. It was really bizarre. And it's not what those things were intended for at all. That's not really validated in any way. So, you know, if you were to do that today, it would not go well for you. Let's just put it that way. And anytime you violate any of these things, not only do you run the risk of potentially getting fired, you could lose your license, you could be called up before your state ethics board. And if it's really severe, you can actually be kicked out of your national organization. So like you can be kicked out of the APA, for example, for an ethics violation. And in fact, Dr. Phil was kicked out of the APA because he had his son, who I believe is not, or at least at that point was not trained or licensed in any way, like doing therapy on the show. And APA was like, dude, he's not even in a training program. But people are fickle, the APA more than anybody, unfortunately. And a couple years later, they invited him as a guest speaker at their convention. So, you know, look at those teeth. So how do you make these ethical decisions? You've got all this information. If you've gone through your graduate training, you know about the tests, but there's still going to be times where, as my graduate ethics professor said, it's a sticky widget. It's not clear cut, right? And so you want to look at something like this moral model by Remley and Hurley. And we'll see on the next slide, there are other models as well. But look at things like autonomy of your client, respecting their freedom of choice. If it's not court ordered, right, or you don't have some other reason why it has to be done, it's up to your client. If your client says, you know, I know that I really should go through this testing so I can get accommodations for my learning disability, but I just don't care. Even, I mean, you could take your time and try to explain to them the benefits to them, but if they don't want to do it, they don't have to do it, right? That's a really important piece of this. Beneficence and non-maleficence kind of go together. So beneficence is promoting the well-being of others, and non-maleficence is do no harm. So the idea is you want to do good. You don't want to be harming your client in any way through the assessment process. And again, that's where things like, is a diagnosis actually relevant here and will it help or hurt my client come into play? Justice or fairness, you need to apply equitable, equal, and fair treatment to all. Fidelity, or this could be translated as loyalty, loyal and faithful to all parts of your role, including the standardization of the test, your commitments in that client-assessor relationship, and any other outside commitments, again, like the court system. And then veracity, be honest in your dealings. If I'm doing a forensic assessment and I'm hired by the lawyer, And the lawyer says, test my client, show him he's crazy, and then we can get him off. And I do my assessment and I'm like, no, this person isn't crazy. I can't lie, right? I say, no, your client isn't crazy. And the lawyer can then choose whether or not to use my report. They're probably going to say, no, thank you, and move on and try to find someone who will find something different, right? So it's really important that you are true to the science and what this is telling you. So this is Corey et al.'s problem-solving model. And so the first thing you're going to do, making an ethical decision, is identify what is the ethical dilemma? What is the problem here? What are all the potential issues involved? Then you go to your ethics code, like at the back of your book, and you review your relevant guidelines and use them to start to guide your decision making. You also need to know your relevant laws and regulations in your states. So the process of getting licensed for a clinical psychologist, for example, like the first thing you gotta do is get your degree, check, right? And then some states require you to get a certain number of postdoctoral hours. Nationwide, you need to pass a test called the EPPP. Cannot tell you off the top of my head what that stands for, but it's like Examination of Professional Psychology, something, practice probably. And then you also have to take a state exam. That might be like just multiple choice, or you might have to do an oral board in front of the assessors, showing that you know that state's laws and regulations. So you know these, and you have to know these. Obtain consultation if you need it. If this is out of your wheelhouse, or you're just not sure, reach out to somebody who would know. You know, it's okay as an assessor, as a therapist, to realize I'm out of my depth of competence. Client, I'm going to refer you to someone who will do you better justice. This person is an expert in the field, they will do a much better job. Or you contact someone who knows their stuff about ethics. So again, not an assessment case, but a therapy case. One of the women in the class above me in grad school, she had a child client that basically she thought they had Munchausen's by proxy, which if you're not familiar with, where the parent intentionally makes the child sick, but for psychological issues. And at that time, that wasn't technically diagnosable, and it kind of is now. So she talked to our professional issues professor. He was like, I don't even know. So they called the APA ethics department and talked to like the head guy in charge. And what they were trying to see is whether they needed to report this as child abuse. And what it eventually came down to is, because they couldn't really prove it, they shouldn't report it. But, you know, I think now with the change in the diagnosis, they would have had to. And you want to consider different possible courses of action. What's going to happen if I give this person these results, and how should I give it to them in a way that is acceptable to them? So for example, I took a workshop on therapeutic assessment, where you use the feedback session after the assessment to kind of start therapy and suss things out. And I had a client that I saw who was inpatient. She had been inpatient for quite some time. Essentially, her insurance was about to run out, and it was really unclear whether she was still severely disrupted, compromised, or whether she was faking. And so what came up in the assessment is that she truly did have some things going on, but she also had a lot of unsureness, particularly around family issues. And so I just sort of shared that with her, kind of the same way I just shared it with you. I said, I wonder if there's anything to that. Does that make sense with you? And she said, oh yeah, my husband and I haven't been getting along, and I don't want to go home. Like, that's great insight on your part. That also starts to answer our question about whether we should keep you here and make you pay out of pocket when your insurance is, yeah, let's maybe get your husband in, do some couple sessions, right? So you feel comfortable going home, rather than going into thousands of dollars of debt. So you might want to even like kind of do a pro-cons list. What are the consequences of my various decisions? And then decide on your best course of action. There are some, in addition to having to know the state laws, there are some federal laws that you need to know if you're going to be assessing, depending on the situation in which you are doing these assessments. So for example, if you will be doing assessments in an educational setting, K through PhD program, you need to know about FERPA, the Family Education Rights and Privacy Act. So some of you, this may kind of strike a bell. Whenever you enrolled in Wesleyan, you actually had to sign a FERPA statement that said whether or not your parents are allowed access to your records, right? And so there's actually in my web advisor where I have my class list, I actually have a list that says who has granted that permission and not. So if your parent contacts me and you have not granted them permission, I technically can't even confirm you're in my class or not legally, right? So I mean, that's really helpful, especially when people are in like abusive situations, right? And so those are things that we have to honor and do right. And this applies to any school that receives federal funding. And that includes whether its students receive federal funding. So since a lot of you, I would guess a majority of you end up taking out federal loans, we fall under that umbrella. And it also means that you have the right to your own educational records. So this is why you all can go on WebAdvisor at any time and look at your programming pal, see where your grades are doing. And this is why you can go on Blackboard, and as I grade things up to date, and you can see them right in front of you. Because you have a right to know what's going on. And this would include if you underwent a formal assessment. Let's say you were a third grader and you went through ADHD testing, your parents would have the right to request the results of that test. They also have a right to ask for a second opinion. The healthcare version of FERPA is HIPAA. It is, a lot of people spell HIPAA like hippo. That's not it. It's HIPAA. So whenever you see someone on Twitter talking about the HIPAAs, the two P's, you'll often see healthcare professionals like posting memes of hippos because they know the person doesn't actually know what they're talking about. But it's the Health Insurance Portability and Accountability Act. And so this restricts information medically in general, but even more so psychological information without client consent. So for example, part of what HIPAA does too is try to make records all electronic and again accessible. And this is why you have like MyChart or a portal or whatever for your doctor, right? So that you can see what your doctor is saying about you and you can access those things. But then within those systems, who has access to things can be restricted. So for example, if I was seeing a client through the Medical College of Georgia healthcare system, and their physician was in that system, their primary care physician could have access to those records. And I could have access to those records, and my supervisor could have access to those records, but no one else in the hospital could. Whereas your general healthcare records, anyone in the hospital can access. And the reason for that is, let's say you're brought into the ER, they want to be able to, and you're unconscious, they want to be able to get your health history right before they do anything to you, so they don't like give you a medication that's going to interact with the medication you're already taking. Put you in the MRI when you have a pacemaker, not a good idea because the MRI is a giant magnet, right? And so it's really interesting that psychological information is even more restricted. And clients can access all their records, including assessment results. The only thing they can't access are what are called process notes in therapy and counseling. Typically, these are often kept in what's called a shadow file, and they might be in like hard copy. These are just the therapist notes to themselves of sort of like, this is what I need to do next session, basically. There are also privileged communication laws, where the licensed professional has the right to keep information confidential. So your book talks about the Jaffe v. Redmond case. And this is a police officer who responded to a fight and shot and killed a man who seemed to be about to stab somebody. He was sued by the family, the police officer was. And the police officer saw a counselor, and then the court tried to subpoena the counselor's records. And the counselor said, I can keep these confidential, and didn't return them over, and the jury ruled in favor of the plaintiff. And this case actually elevated all the way to the Supreme Court. And their final decision was the therapist was right, that a licensed therapist does hold privilege and confidentiality, and they don't have to release those notes. Now, if the person signs a release of information and says, please release these, yeah, they can. Right, but if that police officer didn't want them to release it, they don't have to. The Freedom of Information Act, or this, sometimes you hear this called like FOIA. This allows access to federal records. And this is literally pretty much anybody. So let's say you want to know about the goings on in Congress. They actually like post all that stuff on websites now, and they always have recordings of it. And a lot of states have adopted similar laws. And I'll tell you another story. It has nothing to do with assessment, but sort of interested related to this. So I went to college in Ohio, and Ohio has a state version of FOIA called the Sunshine Act. The idea is that like, information can come out in the sunshine. And we got back from Christmas break one year and found out a professor had been escorted off campus by the county sheriff. And we were like, WTF, right? Like, this seems newsworthy. And so we used the Sunshine Law to just request the sheriff's report. And it turned out that this professor had sexually assaulted a student. Horrifying, right? We didn't know that's what we thought maybe he was like drunk and disorderly or something. So as you can imagine, opened a whole can of worms, but we didn't have any credentials. We didn't even have degrees. I think we were like juniors in college when we requested it, and we were able to get it, right? So certain things like if you have grants, some of that needs to be public access. If you publish under a grant, your paper you publish has to be open access so anyone can read it. And this can have consequences, good and bad, right? The Civil Rights Act of 1964 and then its following amendments says that tests used for employment or promotion have to be suitable and valid for the job in question. Once upon a time, they could kind of give you whatever and basically try to screen you out because of your gender, sexuality, race, ethnicity, what have you, by these sort of sketchy tests. Some people used to do like a Rorschach, the inkblot test. And this says, no, you can't do that. And in fact, for this reason, even when the testing is relevant to the job in question, the person actually has to be conditionally hired before you as a psychologist go and do the assessment. So for example, we typically, I mean, not me personally, but psychologists typically assess firefighters, police, things like that. It's sort of like they go through the application process, they get conditionally hired, and then they go through this screening to make sure there's nothing going on that means like, you know, you're someone who's a psychopath and just wants to watch the world burn. Perhaps you shouldn't be a firefighter, right? Things along those lines. There's also the Individuals with Disabilities Education Improvement Act, whereas anyone 3 to 21 years old who's suspected of having a learning disability or other type of disability must be tested. And not only must they be tested at the school's expense. So this is why schools will hire educational psychologists, and a lot of their jobs is just to test people. Because the school's required by law to do this. And coming out of this will be an individualized education plan. And that will allow for accommodations for that student to level the playing field, basically. Then there's section 504 of the Rehabilitation Act. And this is testing for federally funded programs must be a reflection of an individual's ability, not their disability. So it's like, you're not trying to screen people out based on disability. Like, if someone is applying to something funded by a federal grant, and you are just a horrible person and you're like, I don't want anyone who has a learning disorder, you can't actually do that. And then the Carl Perkins Act of 2006 assures the rights of select disenfranchised groups to access vocational assessment, counseling, and placement. And these are like special populations. So another sort of professional issue here is that we need to think of assessment not in a piecemeal way, like, oh, I think I'll throw this at this person and that at this person and this person, but that it's a holistic process. And really the way I thought of assessment, and I still do, is you have a question you're asking and you want to answer it. It's like a mystery to be solved. And you choose the assessment instruments you use in order to answer that question. So you don't want to use one test score to make decisions. You want multiple pieces of information to make your case stronger and to make sure you're accurate. You also really need to remember that the individual's motivation, intention, and focus will affect scores. Has anyone ever just had like a really crappy day or week and you go in to take a quiz or an exam and you're just like, I don't care, what does it matter, right? That can happen to people when they're going through these formal tests, right? I remember, gosh, it must be like a little bit traumatic to still remember this. I was in like 5th grade or 6th grade and my grandmother had a stroke and was in the hospital. And I had to take like a French quiz. And I was just like, I don't care. And I failed it. And I was like, I don't care. It's 5th grade French, like whatever, right? But the problem is like these do math, right? And so part of what you might do to answer your question is to give that person measures of attention and effort. Not to like be like, gotcha, but to be like, are you giving enough effort that these are accurate and I can accurately help? And assessment isn't a static process, it's ongoing. So in fact, most modern types of therapy that are empirically supported will assess the person throughout therapy. Some will have the person every week when they come to session, fill out a questionnaire. Let's see where your symptoms are. And people do change, right? So someone could have not tested having an attentional problem when they were a kid, but maybe since then they've played a sport like American football or international football where you can get a lot of head contact, those headers in soccer, right? You might now have an attention problem because of an acquired disability, right? I mean, even something you would take this like medical issues, right? I was allergy tested as a kid, super allergic to dogs, not at all allergic to cats. So when I was an adult, I was like, I'll just get cats, it'll be fine. Got re-allergy tested, super allergic to cats. Doesn't mean I stopped having them, it just means that I do a lot of allergy meds and shots and things like that, so that I'm not miserable all the time. Certainly can apply in a psychological situation as well. So again, you need to be thinking about these cross-cultural issues in assessment. We need to look at the quality and usefulness of those instruments and say, is this relevant? Is this going to be helpful? And these are some 10 points that help. We need to assume that all tests have bias, even if like the best person ever made them, Nobel Peace Prize winner made it, it's still gonna have inherent bias because it was made by people. And people have inherent biases. You also need to be in touch with your own biases and prejudices, and these can be hidden from you and ourselves. So there's a test you can take that's called the implicit attitudes test. And the traditional one was made to look at racism, but there's a whole bunch of different ones now. And our equivalent of Dr. Ariel, our cognitive psychologist, was a woman when I was in undergrad. And she did one about women in science, and cognition is one of the like harder parts of more natural sciencey parts of psychology. And it showed she was biased against women in science. So she's like, great, I'm biased against myself, which happens. We internalize that stuff, right? But those are things we need to be aware of when we're in the room with someone. How's that going to affect it? Only use tests that have been shown to be constructed using sound research procedures, and through your group project, you're going to learn what those sound research procedures are. Know there are times when it's appropriate to test and times when it's not. So one of the things we do, especially if we're doing long testing days, is we build in breaks. Right? Okay, we've been doing this for 2 hours. Go take a breather. Okay, we did it for another hour. Go have an hour lunch break. We want the person to be at their best. We also want to know how to choose good tests that are relevant to the situation at hand. And a lot of this is taught in those graduate school courses. And we'll talk a little bit about that in this course as well. And we'll know how you need to know how to administer, score, and interpret them, not just in general, but within the cultural context of that particular client. You know, there are cultures or subcultures where hearing voices is not psychotic, it is part of their spiritual experience, right? So it'd be unfair to diagnose that person with psychosis. So you need to know those things. And if you don't know them, you need to educate yourself. And know and consider the implications that the testing may have for the client, right? If someone is trying to get service connected to the VA, the equivalent of disability in the VA for PTSD, and you're looking at your results and this person doesn't have PTSD, right? It does not that you finagle, but you sit down and you talk with the client about it before you like send those results off, just so you know, just heads up, right? And you advocate for your clients when other people have given them tests that are shown to be biased. We should not pay attention to these previous results, and here's why. Here's the research that shows these tests shouldn't have never been used in the first place. And you want to treat people humanely. I think one of the problems that can happen in psychology in general, but just also as people, is that we start to look at other people as sort of cogs or puzzle pieces, right? And we kind of get in our own heads. And one of the best pieces of advice I was given by one of my mentors at the start of the pandemic, great psychologist, her name is Carolyn Becker, is she said, you know, we're all struggling, but we need to remember our students are people first. And it's like so dumb that I didn't think of that on my own, but like when you were in that panic mode in March 2020, right? You're just like, shoot, how am I going to do this? And how am I going to do this? And it's like, okay, wait, if I step back and I think you all are people, which I know and acknowledge, then that totally changes how I look at things. It's like, let's just try to get you to learn something, right? And let's do it in a way that will work for you in this time of crisis, rather than be like, we must learn X, Y, and Z. Same thing for assessment. If you're a particular client, you realize they need a break sooner, give them a break sooner, right? Things along those lines. Alrighty, so that is the lecture part of today. So let's go ahead at 7:05. Let's take our break. So we'll be back around 7:20. And then we'll do the group assignment. And then we will look at the IRB and what that means and how we use it. Okay. The big thing that is go over the syllabus. I know I have extra copies of, yes, here we go. And then, we went over the first lecture, which I posted the recording today, so you can probably just review the PowerPoint and get everything. But if you have any questions, I have a whole YouTube video of me talking. Recommend you listen to like 1.5 speeds, you don't fall asleep. Okay, awesome. You're welcome.
Well, I haven't seen it, but the thing is, I don't have like a shape of oil bucket. See,
So I don't forget in 2 minutes.
Yeah. Yeah.
Well, I think our first and most favorite angle to it is like not skewed data, not like you're not dying.
Yeah, the problem was that you didn't administer the proper test.
But I think I'm not going to be for not telling them this is what you're not down. Be like this way to make the right and accurate real. More like focus on something more, so okay. No.
Alrighty, so if your group is finishing up, you can just keep typing and then we'll have group 1 start us off. So Allison, Trinity, Julia and Abby. You can just, you don't have to read your whole case, just summarize the high points of it and then tell us the violations you found.
So this was about Dr. Colby and he was assessing my boy. He had some different things going on that he shouldn't have done, obviously while we do this, but he administered a test and at the end of the test, the little boy, he was diagnosed with something. At the end of the test, the little boy said to his parents, "Oh, this is for soccer camp, isn't it?" So some things are going on there. The first violation was confidentiality. So, Dr. Goldie forgot to, well, his parents forgot to ask Dr. Goldie if they can see the report and stuff. Because they were very upset with his finding verbally, and Dr. Kobe does not want to gender kid, which is a violation because they are his parents and they don't like it. And it violates code 1.5.
Yeah, and HIPAA, or I guess FERPA, depending on if this is educational or like in a private practice, right? Yeah, very problematic.
And the second violation that we found was the abstinence from consent. Which I guess we kind of like talked about a little bit, like it was when the little boy was talking about like how he was going to this open camp, right? Because he wasn't told like what these tests were for. So we should have informed Martin the purpose of the assessment and make sure we know what was going on. People can administer the test. And instead of the ethics code violations.
Yeah, and I mean, especially if you're gonna work with kids, right? Like part of your responsibility is to make sure that you put it into language the kid can understand. Yeah, and he clearly didn't do that. Yeah. Alrighty, and violation 3.
Does not encourage the filing of ethic complaints. So pretty much he didn't really like take into account the fact that he was a 9-year-old kid.
Right.
And like, give him the proper assessment or even like mainly taking into account the fact that he was 9. So you really have to go to the parents in that case and you weren't even telling the parents any of the information, so. Yeah, and then that's.
Parents have to give consent to this stuff. I mean, like, we do some research at Chesapeake Bay Academy, which is behind the softball field. And like, even if it's just the most innocuous survey ever, parents have to give consent for their child to participate, right? That's a big part of this. All right, should Dr. Colby be doing assessments?
He said no, because he should be informed about break this many of the codes. If he was continuing practice, we all agree that he should not be killing children.
Yeah. Spot on. Good job, y'all. Yeah, some of these are pretty obvious, right? All right, so next we have Jasmine, Julia, Vincent, and Emily. And again, just brief summary of your case and then walk us through the violation. Jocelyn, sorry. I realized this who just like turned around.
So basically, it's like 2 clients who are like on through divorce and are trying to get custody of their children. The ex-husband is trying to get custody, but the wife is like, think he shouldn't have custody because he like is not calling. He's beating stuff, and the ex-husband ends up getting custody of the children. Yeah. So for the first violation, we said lack of thorough and unbiased assessment. That's 3.01. And it says at the end that the ex-wife is concerned that there could be bias because her new husband is Mexican and not Anglo, like her ex-husband. So that there could be some kind of bias that the psychologist that was her lawyer who was trying to get custody for the ex-husband was like biased against the
Yeah. And again, unfortunately, as we mentioned, even if people don't intentionally do that, it can be there, but unfortunately, there are still bad actors out there who are just blatantly racist. So that is also a possibility, right? They shouldn't be psychologists, in my opinion, but some of them are. All right, how about violation 2?
For that one, we said 3.4 because it was like a boy Marvin's decision making. And he made a decision in regards to his client and then also his client's children. He also assessed, and you could argue are also his clients. And that decision was harmful for the children.
Yeah, I mean, even if the kids themselves are being abused, witnessing abuse has been shown to be really harmful to kids. We used to have a criminal justice person here who was a victimologist, Dr. Margansky, and she studied that. And there's a lot of really clear evidence, unfortunately, that just exposure to abuse is harmful. Yeah, all right, violation 3.
We put 1.07, because it was the, ignorance and ignoring facts that disprove allegations. Because of what you just added, they actually received letters from the kids stating that the father was still drinking and acting in second order.
The kids like shouldn't even have to do that, right? Yeah, and then, one thing I didn't even think about that as you all were talking, I realized is this is also like a multiple relationship issue, right, which is its own ethical violation. So should Dr. Dale be doing assessments? Right, I mean, and it seems like he's also lacking in expertise, right, like he doesn't know the proper, like, this would be like if someone asked me to go evaluate a child, and I had my license, I would be like, I'm not trained in any of that. I don't even know how to get a child to sit still for an assessment. I can barely get my own child to sit still sometimes, right? Yeah, really good point. All right, group 3, do you need another minute? Because we can have group 4 go. Oh, you're group 4? I was gonna say, Day and I were group 4.
Okay, so basically what happened in our story was the psychologist had to, assess someone that was on, death row. And he basically explains that the assessment is going to basically decide whether he lives or dies. And she tells him that the judge is gonna interpret all of these results, and the judge is gonna determine everything. And he worked there. They refuse to do certain tests because they claim that people don't always know how much they are revealing, and if that can get them into bigger trouble.
Go ahead.
First violation, he did E13A because, well, she was supposed to remain objective, especially because she was hired by the court. She was supposed to remain objective in all this, but her talking to him being like, I'm not doing objective tests because you might say something that you don't want to say. Kind of just she's showing that she kind of has a bias towards him, which is still like, it's not okay if you're doing this for legal reasons or doing this as a professional, so. Kind of bias there.
Yeah, definitely. Yeah, I mean, like, technically, even if you were a psychologist who was against the death penalty, right, you should try to be objective in this scenario. And this gets why being a psychologist can be really hard, right? Because you're still a person. Like, one of the main reasons I don't practice is because I was good at it, I think, but I'm bad at compartmentalizing. Like, I'd wake up in the middle of the night worried about my clients. I couldn't sleep. That's not healthy, right? So yeah, I mean, this is things you have to learn to do, and like not everyone can do them. Alrighty, how about violation 2?
So for violation 2, he said it was E7B, which is really favorable conditions, and he said that by them like not administering the condition test that might cause distributing the unaware how much they're willing to test, they're stealing the data and making it to more favorable results with the lack of sharing those things. And we said a more ethical practice is needed and not.
Yeah, I mean, this is sort of comparable to like kind of giving someone the answers in a way, right? I mean, she didn't actually administer the test, so it's a little different, but yeah, don't do that. Alrighty, and how about violation 3? Okay, and that's fine. They might not all have had 3 clear violations, so.
But we went with E5D, the branding through diagnosis, and that kind of piggybacks on planning to where if you those tests, you kind of use a proper diagnosis, which he is allowed to do, but in doing so, he was biased and not.
Yeah, definitely. So what do y'all think? Should this person be diagnosed or assessing?
No,
Yeah, right? Not so much. All right, and then Day and I ended up being group 4. I loved that she was able to participate via Zoom. And she's gonna go ahead and unmute, and I'll have her briefly summarize the case and then talk about the first violation.
So this case, it was pretty much talking about like a religious institution and not allowing well, not being eligible to become a clergy if you were if you had homosexual tendencies. So they asked Dr. Bishop to screen for the individuals if they had it. So the first violation, I said that it violated code 1.08, which is unfair discrimination against compliance and respondents. And it's pretty much that psychologists can't deny persons employment, advancement, things like that, based on that. So I said that a more ethical practice could be that Dr. Bishop could inform them that it is unethical to deny eligibility to become clergy because of that tendency, and that he could assist them in broadening their opinions when it comes to homosexuality. And then if they choose not to compromise with that, then he should not continue assessments because he would be violating the code of ethics.
Exactly, spot on. Thank you so much for helping me out, Day, so I didn't have to do all of them. Yeah, and I think kind of like group 3, we kind of struggled to find 3, so some of these overlap. But another one is just thinking about the idea of homosexual tendencies to be something to assess at all, right? So we looked at 9.02, which is the use of assessments, that you're only gonna do assessments that are based on research or evidence, or the usefulness of proper application of the techniques. And Dr. Bishop is being ethical here. Like, the church is asking him to do this, and he's like, no, I don't think so. And so he's sort of like in the process of thinking it over. And exactly like Day just said, if they're not willing to compromise, he shouldn't do these anymore. And then this was really interesting for me as someone who's been like a student of the ethics code since probably 2006. I was like, wait, is there anything explicitly about diagnosis in the APA ethics code? And there's not, or at least they don't use the word diagnosis. So I went to the ACA one, and it's much more related. So I did mention 9.08 here about obsolete tests and outdated test results, which kind of gets at it. But the APA should really look at the ACA standards, because they are much more specific and helpful in this scenario. That E5C is historical and social prejudices in the diagnosis of pathology. That counselors recognize historical and social prejudices in the misdiagnosis and pathologizing of certain individuals and groups. We need this in our ethics code. The APA issued an apology for their racist past. I think including this in our ethics code would be a really good step on actually doing something about it. And I also loved, and I think a couple of you all mentioned E5D, that they can refrain from making a diagnosis. Right? And that's considered ethical. And so just don't assess for something that's not a diagnosis. And this was something that, you know, it's like, yeah, this guy can probably keep doing assessments as long as he keeps following his gut that, like, this is wrong, he shouldn't do this. And this kind of related back to the APA ethics code principle A, which I think all of these do, right? Which is what we talked about earlier with beneficence and non-maleficence. Like, first, do no harm, right? That's the big statement for these. Excellent job, y'all. I enjoyed hearing y'all talk about these and thinking about the implication. And the reason we cover ethics so early in the semester is, like, I want this to be in the back of our minds as we learn about everything else, right? Like, okay, when we learn about intelligence tests, like, where are the ethical quandaries related to giving those in general, right? Okay, so next what we're gonna do is talk about what you'll eventually do around, I think it's fall break, for your group project that you're gonna come up with your topics for next week, which is the Institutional Review Board application. So can anyone in here tell me what an Institutional Review Board is or does? Exactly, spot on. Yeah, it is a board. It's typically people from within the university. Sometimes there are outside members as well. Here It's at least since I've been here, and I wish before, it's been run by the psychology department just because we use it the most, but we have members from other departments who are on it as well. And yeah, exactly, that was perfect definition, that they have to review any research before you do it. And in fact, if you gather data before they approve this, you would have to throw out all that data because it wasn't conducted with approval. So this can be a obstacle, admittedly, to things. So for example, this summer I was doing some research and I decided to have my student research assistants help me write up the IRB, and stuff got in the way, and that took longer than we thought. And then when I went to go, once we got IRB approved and I went to run it, I realized like the way I was going to collect data through the partner that I use wasn't going to work anymore. So I had to like talk to the partner company, and then I had to rewrite my IRB to explain how I was going to do it and then wait for that approval. So I in fact didn't collect this data until like 2 weeks ago, when I could have collected it in June in theory. So this is an important part of the process, but can also hold things up. Our IRB is usually pretty efficient, which is nice. It usually is within 2 weeks, you'll get a response. I know, for example, I work with some folks at EVMS, and sometimes their IRB takes 6 months. So imagine how far in advance you have to plan in order to be able to do research, right? Alrighty, so for this version, what I've done, oh my God, this is an old template, you can tell, because it's my old school email address. All right, there you go, it's a U. Is I have filled in parts for you that are gonna be the same across all of your different studies, and highlighted the parts you'll need to fill in as a group to make it as efficient as possible for you all. So the first thing you do when you're filling out an IRB is say what level your study is. So level 1 is archival data. Let's say we looked at our departmental assessment data we collect, there's no names associated with it. And we were like, oh, we could probably like present this at a conference. What we could do then is submit an IRB to get approval to do that. You all will be doing what's called a level 2, which means you're collecting the data now. You'll be working with people, but that nothing should be distressing or risky. A level 3 would be the full IRB would have to sit down and review it. As far as I know, since I've been here, no one's done a level 3. This is typically like you're asking about suicide, so then you need to have a plan in place if someone says they're suicidal, right? Things along those lines. We came close once. We had a Psych 480 student do a really cool project where she had people drink either Red Bull or Sprite, and then saw how it affected their attention. And actually, not surprisingly, the caffeine did affect people's ability to focus in a negative way, because they were like amped up. And like some of the reviewers were like, well, wait, could this be like cause a health issue or something along those lines? But eventually she just put a protocol in place where if that happened, she had medical staff she could contact. So you all will be doing a level 2. So you'll get to come up with a title for your research, probably much snappier than when I could come up with. My titles are usually boring. You'll put in your names, emails, and phone numbers here. My info is here again. Let's make that DWU. How about that? And then what I recommend is they want you to write this brief abstract. And I do this last. I fill out the rest of the IRB, and then the abstract is just kind of a description of what you're going to do, really short, 150 words or less. So I go through, fill out the rest of the IRB, and then I can much more easily summarize. I do this when I write my manuscripts too. Like I'll write the whole thing and then go back and do the abstract. So you have to say a research question. And so I have basically hypotheses for you here. And you just fill in the names of your questionnaires. And again, we haven't gotten into the nitty gritty of the group project, but basically what you're gonna do is decide, let's say you decide that you want to make a measure about depression, right? So our new measure of depression, we're gonna give that. We hypothesize that it'll have good internal consistency, which we'll talk about next week. And then you will give two other existing questionnaires. One will be a measure of the same thing. So if you were making a new measure of depression, there's a well-validated one called the Center for Epidemiological Studies Depression Scale. You could also give that one, because you're trying to see, does your new scale of depression relate to an existing one? And then you're also gonna give something that shouldn't be as related. So I don't know, something about math skills, you know, it could be anything random that you want. And that shows that it isn't measuring that, it's measuring depression. So basically you'll put in what your questionnaire measures, the questionnaire that supposedly measures the same thing, and the questionnaire that measures something opposite. And if you guys have trouble finding these, I'm like a whiz at finding stuff, so I will help each and every group. Alrighty, so next you have your method. And one thing I realized is that, you know, I said they do paper and pencil questionnaires, but you all can make these online if that's easier, if you want to do a Google form, or if you want to collect through Sona. It has its own Google form-esque thing you could put it in, so you can change that if you want to. And then every participant will fill out demographics, the questionnaire you design, and then those two other questionnaires, one that measures the same thing and one that measures something that shouldn't be related. And then it should take 10 minutes because they're only filling out maybe, you know, 20 to 30 questions, right? I wrote these parts for you because why? You're all gonna write the same thing. In terms of like, everything will be anonymous. You're not gonna collect names except on the consent forms. One of the things your group needs to think about is where are you gonna store your data if you are gonna use paper measures? Or if you do a Google form, how are you gonna secure it and secure your data, right? But yeah, with paper forms, you wanna make sure like you don't leave them in your backpack spilled out in the middle of the library, right? Things along those lines. Your group decides if you wanna do, you know, and this should really be, I didn't write this form, this should really be all genders now, just saying. Or whether you wanna use just one gender. You have to do 18 plus just because we don't have procedures in place to get parental consent for any students that are 17. And then we're not going to be using anyone who's mentally incompetent, legally restricted, or institutionalized. And then again, VWU. Students will be approached. If you're going to do paper ones, think about where you would approach them. Are you going to do it in the CAF, in the grill, in the library? Ask your friends. Or are you going to do it online? And if you do it online, who are you going to email it to? Or are you going to post it on Sona? Are you going to do both, right? They will do written consent. And I have a sample of that, so you all don't have to read it from scratch. I did the risks and benefits for you, so you don't need to worry about that. And then we always do like a cost benefit ratio. And so like, not only are you all potentially creating great new measures, but this is also the educational benefit of training you all in how to make a measure, right? That far away outweighs the minimal risk. Then you'll also have a debriefing form, which again, I've given you a template for. You'll type your signatures here. And then here's the sample informed consent. So you'll put your names, you'll describe your general purpose, what they'll do, how they'll complete the survey. It'll take like 10 minutes. Any risks or benefits. And then knowledge of study results. Are you going to debrief them right away or wait till you collect all your data? You put your contact info here. This is now Dr. Martero. And then demographics, you get to choose what you want to ask about. I usually recommend age, gender, race, but maybe you're interested in class year. Maybe you're going to study something about relationships. So you want relationship status, right? Maybe you're interested in sexuality or gender identity, right? Think about those types of things. All right, and then here's where you include, you just copy paste the questionnaire, so yours that you all developed together. And then the questionnaire that's already published that measures the same thing. And the questionnaire that measures something different that's already published. So again, just copy paste. And then your debriefing, and I will update this as well, because this should be April and Brandon. I can get their info real quick here. From your syllabus. And I'll make sure, I think right now I just have the Word doc posted. I'll make sure I give you all copies, access to this one, and you could just make a copy. Here we go. I learned during the pandemic, I can't talk and click at the same time, but I still like try to do it. It doesn't work. Okay. So it's unlikely, let's put it that way. That's a very nice way to put it, that anyone will become distressed filling out your questionnaires. But as psychologists who just learned about ethics, right, we want to make sure that we have our bases covered. So if someone did become distressed, we have the information right here. This will be Dr. Martorell. Okay. And then we thank you for your participation, your names and emails. And look, I changed that one at some point. I didn't change all of them. And that's it. So yeah, it's like 12 pages of theory, but you all don't actually have to fill in that much stuff, right? And I did that on purpose. I don't want this to be a big burden. But the cool thing is, if you all do decide, like, we found some pretty cool results. We've actually had students from this class present at our state conference, the Virginia Association for Psychological Science, in the past. And so you get the experience of going to a conference. The university will pay for you to go. And then you get to actually like put it on your resume or your CV that you presented at a professional conference. So it's a really nice thing to put on there. All right, any questions about that? Any questions about ethics in general? Cool. Well, stuff will come up, but that's okay. All righty, then we will be all done for today. So thank you all for being so attentive. And I know these beginning parts are harder because there's a lot of me talking. So thanks for hanging in there. I try to like break it up with assignments and whatnot.